strategies I've employed, and I did a group with some grad students earlier today, and setting really firm limits of all notifications go off at 7 o'clock. I'm making this up, whatever it might be. And when I wake up in the morning, I don't look at any notifications until I finish breakfast, and I go for a 5-minute walk, whatever it might be. But those notifications will be there whenever you choose to open that back up. And I know that it's hard to not let those thoughts of what's there, let me go see it, let me go check. But on days I do it versus days I don't. I know my stress and anxiety levels, and I know my family also appreciates when I set those healthy boundaries as well.
Okay, so loneliness is not a diagnosable condition. It's not in the book that we use to make mental health diagnoses. It's in some ways part of the way we think about clinical depression, but it alone isn't something that we can diagnose. In fact, when we measure loneliness, we tend to measure it on a scale of how not lonely to very lonely folks feel. So it's not even a thing like you're either lonely or not. And most of the research has not thought about it that way. So it tends to be the second thing you articulated, which is it's a precursor to and really strongly related to a lot of mental health conditions. Things like depression, anxiety, thoughts about harming oneself. And, you know, it's frankly so widely experienced, like the Surgeon General highlighted, it's an epidemic. So if we diagnosed people with feeling lonely a good amount of the time, it would be so many people, it wouldn't be abnormal. It sounds strange for me to say, but truly we're thinking of it as a feeling that is so directly related to many of the mental health conditions we diagnose that we want, in order to prevent them, we have to address it.
To be honest, for myself, what really got me here was saying yes to some opportunities that sounded really interesting. I didn't get my doctorate in clinical psychology to work in tech. I thought I was going to be in private practice. And I think it was really, taking an opportunity to consult on a large project and then saying, that's really interesting. Let me look at this nonprofit, which brought me to some scalable work. But all that I do say that while you are in grad school, if you should pursue this, asking questions about grad programs that do offer experiences like this, trying to find an internship at an organization like Grit Digital Health or Hopelab. There's a lot of things that are in place that were not there when myself and Danielle were finding our way.